morning and welcome.
Yeah.
My name is Karen Ayala, and I serve as the Executive Director of the DuPage County Health Department based in Wheaton. Thank you for participating and coming out to our agency's Protect Swimmers Day event. Partners from across the Chicago area have come together today to share one simple message: keep children safer near water. The need is urgent. In 2021, 18 Illinois children fatally drowned in swimming pools and open water. In addition, 3 adult caregivers fatally drowned while rescuing young swimmers from deep open water. But we can change this. Today, water safety advocates and experts will provide critical information, life-saving information for parents and caregivers. They will define water hazards, risk factors, and preventative actions to raise awareness in order to prevent drowning. Importantly, through this event, we also honor the life of Anna Faye Trent, who fatally drowned in a life-guarded pool 1 week after her 4th birthday. Anna's family is here with us today to bravely share their story so that no other family loses a child to drowning. Together, we can protect swimmers and keep all children safer near water. So please help me welcome the coordinator and public health advocate extraordinaire of DCHD's Protect Swimmers 10M initiative, Laura Carlin Cochran. Thank you.
Coordinator of Protect Swimmers 10M. In 2021, our agency received a second competitive grant award from the United States Consumer Product Safety Commission. And this grant award enables us to implement an enforcement and education initiative throughout the greater metropolitan Chicago area. I'd like to begin by thanking our event host, the FMC Natatorium in Westmont, and also our partners and our speakers who are here today, including Dr. Michelle L. Macy from Ann and Robert H. Lurie Children's Hospital of Chicago, and Amy Hill, Michael Petrella with the Cask Water Safety Foundation, Cynthia Pedola with Boys and Girls Club of Chicago, Carly Trump of Advocate Children's Hospital of Oak Lawn, and James and Katie Trent of the Fort Ann Foundation. Thank you all so much for your partnership throughout this initiative. So, today is Protect Swimmers 10M Day. And as the name suggests, our goal today is to reach the 10 million children and adults who are residents of the greater metropolitan Chicago area. And we're doing this in order to prevent child drowning. It is our agency's honor, my honor, to work with the Trent family to share their story of their daughter, their sister, cousin, and their niece and friend, Anna. I received this green band years ago from Anna's mom, Katie, and the band says, "Guard for Anna." When I look at this band every day, I remember the day that I met Anna and her family at a soccer game. It was a soccer game for my son and Anna's older sister. This band is a daily reminder to me of the urgent need to reach as many parents and children and caregivers as possible to prevent another drowning tragedy from occurring. I will continue to work my hardest for Anna, for your family every day. As Karen said, last year, 18 Illinois children fatally drowned in pools and open water. And when we say open water, we mean detention ponds, other ponds, rivers, small lakes, the Great Lakes, and even oceans. Drownings can occur at any time. This includes during swimming times and unscheduled non-swimming times. It is most likely to occur in the evenings between the hours of 6 and 8 p.m. and on weekends. Data shows that boys are more likely than girls to drown. Younger children under the age of 5 are more likely to drown in swimming pools, while older children and teens are at greater risk for open water drowning. 18 children, 18 families, 18 stories. It's hard to comprehend. Although, as I look around this room, I know that we will change this. Through Protect Swimmers 10, our agency has facilitated trainings for hundreds of enforcement personnel from health and building departments across northern Illinois to improve their understanding of drowning risk factors and also best practices for compliance with enforcement of the federal Virginia Grant Baker Pool and Spa Safety Act, or the VGBA, and also the drain cover standard. Through Protect Swimmers, we have also reached millions of residents with our education strategies to improve understanding of water hazards, drowning risk factors, and suction entrapment, which is a priority prevention topic of the United States Consumer Product Safety Commission. This is not a commonly understood prevention topic, so I'd like to just tell you a little bit more. Entrapment can occur when a part of a swimmer's body becomes attached to a pool or a spa's drain cover, and this is due to the suction force of the pool's water circulation system. But to prevent entrapment, swimmers can swim away or stay away from drain covers that are often found at the bottom of the pool or on the sides of the pool or hot tub. In addition, all swimmers should keep their hair, any jewelry, straps, and even drawstrings away from drain covers. If a person is in the pool and they see that a drain cover is missing, broken, or loose, or wiggling or wobbling, they should exit the pool and tell a manager, a facility owner, or a lifeguard right away. So in addition to staying away from suction drains and pipes, parents and caregivers are urged to take other steps to prevent child drowning. We can all use layers of protection, including 4 to 5 foot fencing on all 4 sides of a pool and spa covers, and self-locking and self-latching gates to prevent children from accessing water. This is especially important if a home's back door opens to open water or a pool. Adults are also urged to teach children to swim and to self-rescue. And if a child is ever missing, please check the water first. Adult water watchers should also stay focused on the swimmers who are in their care and learn life-saving skills, including CPR. Now, young children are encouraged to learn to swim and to self-rescue, to never swim alone, and to always stay close enough to hold hands with an adult water watcher. Older children are encouraged and urged to wear life jackets when they are swimming in open water and to avoid strong currents or rips in open water. Our next speakers will go into greater detail about protective steps and preventive actions. Together, we can prevent one more sibling, parent, friend, or neighbor from experiencing the loss of a loved one due to drowning. Together, we can protect swimmers. Now I'd like to welcome Dr. Michelle L. Macy, pediatric emergency physician with Ann and Robert H. Lurie Children's Hospital in Chicago.
Thank you, Laura, and thank you to DuPage County and to Anna's family for bringing together this group of people to highlight an important issue that we can't ignore. More children ages 1 to 4 die in drownings each year than die of birth defects. And for children 1 to 14 years of age, drowning is the second cause of death only after motor vehicle collisions. In the United States, every year, 4,000 individuals die in drownings. On average, that's 11 people who fatally drown each day, and twice as many individuals experience non-fatal drownings, from which they can have lifelong injuries. As an emergency physician, I care for children who have experienced fatal and non-fatal drownings, and also work with their families after they come to seek care with us. And in talking to families who have experienced a drowning, I see it as an important area for us to really emphasize the importance of prevention of this unintentional injury. Many drownings are preventable, and knowing the risk factors are crucial for us to make change and reduce these injuries. Age is an important risk factor. Toddlers and preschoolers are inherently curious. They're interested in water, they're intrigued by toys that are in and around water, and they can get into water unexpectedly, and few have the self-rescue skills necessary if they're unsupervised. So families need to focus on layers of protection, and our community needs to focus on layers of protection. Draining buckets, bathtubs, and kiddie pools, and making sure children aren't unsupervised around those household bodies of water is crucial. Never leaving a child alone for a bath, even for a second, to go grab a diaper or grab a towel. Keeping young children away from water by using four-sided fencing with self-locking gates. Using Coast Guard approved life-saving equipment and life jackets. Designating a water watcher, and that water watcher's sole responsibility is keeping eyes on the children that are under their care. Water watchers are important when swimming in areas that don't have lifeguards, but they're also important in lifeguarded facilities. Focusing on swimming activities in lifeguarded pools and beaches, where that layer of protection, expertise, and CPR training is readily available. And helping children learn self-rescue skills, particularly in the toddler age group, before they're ready to learn swim techniques and strokes. For teens and young adults, we shift into a set of risk factors that are really important for us to think about. Teens and young adults engage in risky behaviors. They swim in areas that are fun and exciting, off rocks and off piers where there can be fatal currents that are very dangerous. They often tend to try to swim in places that aren't lifeguarded and in hours after lifeguards leave. And then they can engage in swimming after alcohol and drug use. And those are all factors that are preventable and avoidable. So with our teens and young adults, we want to be swimming in safe areas, not getting into water if red flags are flying, avoiding piers and rocks, and being sober whenever we're enjoying the lakefront and pools. A third important group is people with medical conditions that include seizures, autism, and heart conditions. Families and children and adults who have these types of conditions can work with their doctors to understand how they can safely enjoy water. And bathtubs are an important spot for drowning for these populations, so we ensure that showers are used whenever possible. Water safety knowledge and skills are important to develop, practice, and maintain. Even if you never learn the butterfly, most kids and adults can learn self-rescue skills like how to surface, float, and propel themselves to safety. It's also really important that we all understand how to respond to someone who's in trouble near the water. We heard from Laura that we lose 3 parents and adult caregivers for the 18 children who died in Illinois last year. We want to make sure that those adults are first calling for help, then reaching and throwing, don't go. We never want people to put themselves into a dangerous situation and create more victims in a drowning. Learning CPR is another essential skill to help folks who have experienced a drowning. And for people who are enjoying pools and hot tubs, being sure that the pool equipment is checked regularly for safety and maintenance to prevent entrapment and dreams. Taking measures and arming yourselves with education will keep you and your families out of emergency departments this summer and enjoying all that Metro Chicago has to offer by pools and beaches. And with that, it's my honor and privilege to welcome our most important speakers today, Trent and Katie. and we are going to, or I'm sorry, James and Katie Trent. So we're going to welcome James and Katie Trent, Anna's parents, and the founders of the For Anna Foundation.
Thank you, Dr. Macy. And thank you all for having us here today to share Anna's story and our family's story. First of all, I'm James Trent. This is my wife, Katie. Today with us are daughter Olivia, son Ben, and our youngest daughter, Maggie. On Father's Day in 2016, we decided to attend a local club facility that we had never been to before with some other extended family members. After spending what was mostly a normal day at the pool for several hours, we barbecued and spent the day swimming with our family. Around 7 p.m., the pool facility called a break, and our kids exited the pool area. Apologize. We decided as adults that it was time to go home, so we began to pack up our belongings. Around 7:15, the break was called back in, and the kids were allowed to go back in the pool. Most of the children asked if they could go back in for a few more minutes while we finished packing up. Anna followed, and she went back to an area that she had been swimming most of the day. This was a shallow area of the pool where a mushroom shower existed, probably similar to an area most of us are very familiar with pools. This area had been lifeguarded most of the day as well. Unfortunately, during that break, the pool facility had taken one of the two lifeguards down for capacity or staffing reasons, which we were unaware of. And we also were packing up and not as focused on her at that time. Within about 5 minutes, our lives changed forever. We heard a whistle, and our daughter was gone at that point. We created the For Anna Foundation to focus on layers of protection that we believe would have helped Anna survive that day. And many of these layers of protection have been discussed already. One thing we're frequently asked about is swim lessons. What swim lessons did Anna have prior to that day? We, like many people, spent some time looking for lessons. We even had Anna go to a fairly popular local group lesson facility where she received pretty standard swim lessons at the age of 3. Quite frankly, there wasn't a lot of impact for her through that process. And then, my wife and I decided that we wanted to get her some additional lessons. And we were trying to schedule lessons at the time with a private instructor that was teaching her older daughter. Unfortunately, we were unable to get that scheduled prior to the time she passed away. What we didn't know is that there are self-rescue lessons that are available for children as young as 6 months old. After Anna's death, we signed our younger children up for these lessons. Their lessons were so impactful that I would say our son and younger daughter's skill set were stronger at age 1 or 2 than our older daughters were at age 4. Olivia's at 5 or 6. We think it's so important to promote these types of lessons and make this really the type of swim lesson that children receive at age 1 or 2, so that they can actually save themselves in the water in the event that all these other layers of protection fail. We are so thankful to have met our next speaker, Michael Petrella, who actually taught our son Ben and Maggie lessons, these self-rescue lessons that we feel are so important. He is an aquatics behavioral specialist with the Cass Water Safety Foundation, which we partner with, and I would love to bring him up to speak right now.
Good morning. About 15 years ago, my dad sent me a video attached to an email. Wound up changing my life. In this video, a boy named Miles walks out of his back door of his house, reaches for a ball at a backyard pool, falls in head first. The video was created as a reenactment of a real-life situation that occurred of a little boy who had gone into the water when it was not swim time alone and drowned. So many people don't know that drowning is a leading cause of accidental death for children ages 1 to 4, and it most happens during non-swim time. The video of this tragic scenario was recreated to show what is possible. You see, this time in the video, the boy resurfaces. He rolls onto his back and he lays there breathing, resting for over 5 minutes until help arrives. Miles had taken self-rescue swim lessons. When I first saw this video back in 2007, I thought what most of us would think. It's on the internet and it's not real. Certainly a child 14 months old isn't able to do that. At the end of the video, there's a website link. Of course, I clicked on it. At the time, I was living in West Michigan, and I had a 1/4-acre pond in my backyard that was just feet from my back door. I knew that if my then 2-year-old found her way to that pond alone and fell in, that she would be gone. I was surprised to learn there were no ISR self-rescue swim lessons in the entire state of Michigan. Just 6 months later, I was training to become an instructor. Since then, I have taught thousands of children to swim, float, and self-rescue. And as an ISR master instructor, I have taught dozens of adults to deliver these same lessons. While I've worked all over the country, I was brought to Chicago by Cass Water Safety Foundation. Cass' mission is to prevent drowning and create safer swimmers sooner. We do this by increasing access to self-rescue swim lessons through our growing team of instructors, empowering families through education to create strong water safety strategies, and by providing scholarship support to families. I connected quickly with Cass and felt a bond with them as we share values and beliefs about how this issue of childhood drowning must be tackled. I now am the Director of Instructor Development for Cass. At Cass, we believe in having difficult conversations and having the courage to tell families and communities about drowning prevention strategies that have the potential to drive change, and in breaking down barriers to access so that families willing to commit to self-rescue lessons can participate at a price they can afford. As we work through this mission, sometimes we laugh, we always work hard, and all too often, we cry. We hear tragic stories all too often. At the end of the day, it's the little lives we protect and the parents who build trust in us that really get us choked up. This brings me to the Trent family. I first had the honor of meeting the Trent family while they participated in self-rescue swim lessons with me and my team at Cass in 2020. We put our all into every child we teach. But when it comes to safeguarding kids who have lost a sibling, we experience indescribable motivation to not only keep going, but to be louder about what we do and why we do it. I can't imagine losing a child simply because I turned my back for a minute. I can't imagine being 6 years old and losing my 4-year-old sister to drowning. This happens multiple times daily, as you heard, in our country. It happens fast, it happens silently, and it happens to amazing, intelligent, attentive parents. Drowning knows no season, demographic, parenting style, or logic. Any child that has access to the water can be gone in under a minute. As you heard, every child that loses their life to drowning, many more suffer life-altering injuries. As we already mentioned, drowning is the most likely thing to take a 1 to 4-year-old's life. At CAST, we believe that the skill of the child is the most important piece to the drowning prevention strategy. And we examine the circumstances around what brings children to the water alone, unskilled, and overconfident. With all this in mind, we have a vision of creating a water safety strategy that focuses just as much on what we do as it does on what not to do. We call this movement Casting Hope for Safer Swimmers, and we invite you to join our cast by sharing what you are learning today. Here are some things we know will help you keep your loved ones safe. Parents of drowning overwhelmingly report that it happens during non-swim time and that their child thought they could swim but could not. Floaties, life jackets, and puddle jumpers do not help a child learn to swim. They give a child a false sense of security, teach them a vertical posture in the water that is counterproductive to effective independent swimming, and lead a child to have a false sense of confidence in the water. Puddle jumpers like this are not Coast Guard approved or even evaluated for a swimming pool. While they keep a child afloat if they fall into the water by accident, they do not help the child learn to swim and should not be used during fun and water play in swim time. This puddle jumper was used by a dear friend of mine, their daughter. She enjoyed being in it, and she was encouraged by her parents to jump in the water as they videotaped poolside. Later that day, she went back to the pool without it on. She had no concept that she couldn't swim, and she lost her precious little life that day. I now have the honor and the responsibility of teaching her 4 younger siblings how to self-rescue and manage the water safely without the use of a flotation device. So how do we survive summer without floaties? First, always be in the water with your child. Being in the water with them is the easiest way for you to focus on them. And if you're holding them or right near them, they learn that they need an adult in the water with them when it's swim time. They also learn more about their natural buoyancy or lack thereof in the water. Next, always use the Coast Guard approved life jacket on pool decks, at the beach, on a dock, and of course on your boat in the event of an accidental fall in. But again, that tool should not be used during swim time. If you are outnumbered by non-swimmers and can't provide one-on-one supervision, choose a different activity. Make it a sprinkler, water table, or splash pad day. Our children's lives are too important to choose differently. Remember, water is the #1 risk to your child's life. There are plenty of years for pool time fun after the child learns to swim and be safe in the water. Teaching a child to have fun and love the water before they know how to manage the water safely is the same as presents the same dangers as teaching a child to play with his toy trucks on the 2 yellow lines out in the middle of the road. Of course, we would never do that. And as you heard, I love that a lot of these strategies are repeating amongst all of our speakers. Designate a water watcher during swim time and have segmented supervision during non-swim time. Determine who is in charge of watching the kids, and that person can give full attention to the situation. If you think everybody is watching the pool, no. Nobody is in charge, and supervision will lapse. Invest in high-quality self-rescue swim lessons. These lessons are available here at FMC and several other locations in the Chicago area. To find out a list of questions, to see if your instructor is qualified, visit castwatersafety.org. This new way of thinking will truly make a difference. Here's a review of the basics. Use the Coast Guard approved life vest on boats, piers, and near open water of any kind. Use constant, segmented, effective supervision. Determine who's in charge of watching the kids. Create barriers between children and the water, such as locks on doors and windows, four-sided pool fences with self-closing, self-lashing gates, and alarms. Learn CPR. If a child is missing, always check the water first. And yes, invest in swim lessons, but make sure they are high quality and will teach a child how to float, rest, and breathe. As we like to say at CAST, we teach skills before thrills. CAST is a 501c3 nonprofit organization, but what we need more than funding is awareness, and that's why we're here today. Every family deserves to know the truth about how to safeguard their child. If I could ask you one thing today, it would be to leave here and tell a few families what you have learned. Yes, it can be awkward to talk about and to share, but your courage can save a child's life. My dad had the courage to share this topic with me over 15 years ago. It certainly changed my life and the lives of thousands of children that I've taught. I want to thank the Trent family. You inspire me more than you know. I'm sorry we did not reach you with our message in time for Anna, but we adore and cherish Olivia, Ben, and Maggie, and it is an honor to teach them to be stronger, safer swimmers. Thank you for your advocacy, kindness, to prevent others from experiencing this tragedy. Thank you to the FMC. CAST founder Liz Huber brought me to the FMC construction site pretty much immediately when I first arrived to Chicago to connect with CAST. This was a frame with a hole in the ground when I first got here. We know that when highly respected traditional and competitive swim organizations embrace self-rescue swimming first, real change can be made. Thank you to the Kaufmans and our FMC team for leading the way. In closing, I will leave you with this. The statistics are frightening and haven't changed much in over 40 years. I know that together, the Trent, DuPage County Health Department, Ann and Robert H. Laurie Children's Hospital of Chicago, the FMC, and the Boys and Girls Club of Chicago, along with CAST, we can and will save lives. I'm Michael Petrella. Thank you for being here and for helping us all make a difference. Next, I would like to invite to the podium and introduce the Boys and Girls Club of Chicago Aquatics Director, Cynthia Petrella.
Thank you, everyone. A study conducted by the American Red Cross found that 61% of the children, including more than half of all teenagers, can perform basic swim safety life skills. Similar studies done by USA Swim and YMCA associations found that minority groups have the lowest rate of swim instruction. There's a difference between swimming competency, swimming lessons, and drowning awareness in young adults. Boys and Girls Club, we're envisioning making lifelong opportunities for all of those who participate, regardless of what age group they may be in, but especially to minority groups, and especially in the communities that need it most. So really, what do we need? Really identifying the drowning risk among the young adults and the relationships between the risk and the actual water competencies between them. As many have already mentioned, using layers of protection in and around the water, being educated and providing awareness will take us a far way. Very similar to how our speakers have said, be a water watcher. Teach children and young adults and all adults really when and how to be in largest bodies of water, especially like the city of Chicago, where we have Lake Michigan. Knowing and recognizing what a safe life jacket is, and emphasizing really on following drowning prevention strategies. At the Boys and Girls Clubs, we have committed to make this part of every youth's basic life skills. It really is our social responsibility to promote awareness and accessibility to our communities, especially to those communities that need us most. Sorry.
Thank you, Cynthia, and to all of our speakers.
With this tireless group of advocates who are here in the room today, I believe, and I think we all believe, that we can change water safety practices and generate sustainable preventive strategies to keep all children and their caregivers safer near the water. I would like to thank our Protect Swimmers 10M campaign partners from all over greater metropolitan Chicago, and this includes swimming facilities, hospitals, pediatricians' offices, residential communities, municipalities, cities and villages, our park district partners, and community-based organizations. Thank you all for your dedication to child safety and to the protection of swimmers. Again, thank you also to our event host, the FMC Natatorium in Westmont, for welcoming us today to this beautiful and groundbreaking facility. And to my colleagues who are here from DuPage County Health Department, thank you for your dedication to the success of this campaign. I could not be here and could not be here at this event without you. Thank you. Last, thank you to our media partners who are live streaming or who attended today to learn and listen to our prevention stories and also prevention strategies. We hope that you will leave and share this information to protect all swimmers. And again, I'd like to thank our speakers, Michelle and also Amy from Blurry Children's, Cynthia, James and Katie and Michael. It is an honor to know you and to work alongside you. You know how much this means to me and how this comes from the heart, and I couldn't be here without you, and thank you so much. And all of our guests who came today, I hope that you will share what you've learned, and thank you for the work that you're doing to keep our community safer. And thank you all so much for being here.
Yeah, no, I didn't.